Hey guys, it's Kim again. As Kate mentioned, yeah, we have multiple people that are unable to attend and send their questions in advance. In advance. I know that we've got quite a few people with their hands raised, so I'll just go ahead and start with one for right now, and then as everything wraps up, I'll ask the others. So this is related to this person's case, but I think it could be relevant to quite a few people. Their question was, I had the NUS procedure performed in 2018 in Australia. I developed chronic pain following the surgery. My question is, how do you suppose the bar removal may impact my chronic pain? When the bars are removed, do you cut out nerves as part of scar tissue, which also potentially sensitize nerves that are causing the chronic pain?
So my sense from that question is that the pain predated the bar removal. Is that a correct impression?
So the bars have not been removed at this point. The bars are still in place for that person. They've had chronic pain and essentially
with the bars in place.
And they're just curious, if the bar is removed, does the chronic pain go away?
Yeah. So I would say there is hope for this individual that with bar removal, some of that discomfort will go away. I can't be absolutely certain of that because, I would need more information and be able to, examine the patient and see some x-rays in order to be absolutely certain of that. But in my general experience, if people, and I think Brandon's experience was highlighted this, there's always a little bit of discomfort, especially if you sneeze or cough or, take a big deep breath while exercising. You definitely tend to feel the bars. And once the bars are removed, that sensation of restriction it ceases to exist. So I think that is a relief for almost all NUS patients to have that sense of restriction come to an end.
Okay, and this was a two-part question. The other part was that surgeon recommends having the bars remain in place for 4 years. Is it reasonable? Is 3 years enough time?
Well, in my experience, if the patient is no longer growing, and the correction has been done appropriately, in my practice and in my hands, 3 years is all the time that's necessary to achieve a permanent correction of the deformity. So I would say 3 years is more than adequate. However, a direct question to the surgeon who implanted the bars regarding the timing of removal should be respected, and the answer hopefully will be a good one for the patient. But 3 years, in my opinion, is more than enough time. That's based on, 1,000 cases, is more than enough time to achieve a permanent result. The other question that individual asked was, are nerves injured or removed during the course of doing a bar removal? And the answer is no. Now, in saying that, there may be small little cutaneous nerves that are disrupted in lifting the skin up to expose the area beneath the skin where the bar is located and needs to be freed. But those small little nerves that are cutaneous nerves that give us a sense of pressure sensation and sensation, those regenerate. And that numbness that sometimes patients experience resolves on its own in fairly short order. But any real deep pain should not be present after a successful removal of the bar. And people who have pain after bar removal, may have it because of how the bars were actually implanted in the first place. Some people use non-absorbable sutures to actually fix the bar to the underlying bony rib. And sometimes those sutures, if they're too tight and are around the bar and the rib, can put pressure on the deep nerve, the intercostal nerve, and that can cause pain syndromes after bars have been implanted and even after bars have been removed. But no direct removal of nerves occurs during insertion or removal, and chronic pain after bar removal is very rare.
Can you hear me? Can I elaborate on my experience with that? Or?
Absolutely, Brandon. Go right ahead.
Okay, so after the bars were put in for me, somewhere around 6 to 8 months afterwards, I don't know if you remember, but I did experience some nerve pain on my back, like in my lateral muscle area. Whenever I would put my arms up to put my shirt on, it felt like somebody poured boiling water on my skin, which was terrible. But that went away after a while. That just went away, and there was never any issue with that again. I did experience that a little bit after the bar removal, just on my right side this time, and it was only for like maybe one night, maybe 2 nights, and then that completely went away. This was a month and a half ago. I had my bars put out, and I'm perfectly fine now. And as far as the sneezing they mentioned, the whole way through the 4 years that I had my bars put in, that never changed. I absolutely dreaded sneezing the entire time, just because when you sneeze, it's one quick motion that your chest expands, and you just kind of have to get through that. But to be honest with you, it's been a month and a half since they've been out, and I actually forgot already until somebody just brought that up. That it don't bother me to sneeze now. I don't even think about it. So.
That's great. And Brandon, I think your symptoms that you were describing had a lot to do with the need that we had to secure your bars. Your chest was very deformed. It was very rigid. Your chest was very heavy. You had a very developed chest. And in order to make certain that your bars stayed where they needed to, we used some of those sutures around your bar and the underlying bony rib. I try not to ever put those too tight, and I always use an absorbable suture, a big suture, but an absorbable suture. And the fact that went away at about that 6 to 8 month period might have had a lot to do with, one, your chest starting to, put less pressure on your bars. Your chest was starting to really change under the influence of the bars. And that suture around your bar and the rib starts to really dissolve and go away at that 4 to 6 month period of time. So that might have also helped to relieve that sensation. I mean, you had a very unique and very severe anatomic challenge, and it's not uncommon for people like you to have some pain issues that are longer and more significant than patients who have less severe deformities. So I think your situation was unique.
Right.
Next question.
Okay. Yeah, with that, I'm going to pass it on to Kate, who will reach out to the audience.
Perfect. We're just going to start at the top here. Jessica Hanumi, you're up first. I'm going to ask you to unmute yourself if you need help finding that. Perfect.
Okay.
Go for it.
Hi, Dr. Losasso.
Hi, Jessica.
My question is there a pattern that you see with people having issues with the calcification? And is that something you would see before we underwent the removal?
Great question. You might see it, Jessica, by the follow-up x-rays that we all get at yearly intervals with someone who has a bar or bars in place. I personally, as Dr. Nuss taught me, get a chest x-ray on a yearly basis during the time the implants are in place. So sometimes if you look very carefully, you can start to see a little calcified shadow around the ends of the bar that will tip off the surgeon that calcification may be a problem, and to be prepared for that. There's no way to predict from bar insertion whether a patient will develop that unique reaction to the bars. But I can tell you that Brandon's story is a very typical one, in that someone who is very active, whose work or whose things they like to do, like working out or doing very, very strenuous exercise, is part of what they do and who they are. Those individuals, I think, from just the stresses that the chest wall places the bars under, tend to have this calcification develop. So I think a little bit of it is activity related, and a little bit of it is the unique way that some people respond to the bars. It doesn't make it more dangerous to remove the bars, but it does make it more difficult and requires more time. I don't think there's anything that a patient needs to do differently living their lives after bar insertion. It's just something that some people have happen, and the surgeon needs to be prepared to deal with it.
Thank you.
Thank you.
Next up, Nabil, do you have a question for us? I'm going to unmute you. Are you still here? Can you hear me? Unmute yourself. Perfect.
There we go. Can you hear
There we
me?
go.
Perfect.
Hi, Nabil.
Hi, Dr. Lasasso. How are you?
Good, thanks. And you?
I'm good. So first, obviously, I wanted to thank you, Dr. Lasasso, but I also wanted to thank Brandon. I think I've said this before in a previous webinar of yours, that it's really great to be able to see someone who has, a similar kind of issue with pectus, on such a popular TV show. It's just a very heartening thing. So I think I really appreciate that, and I'm sure many other people with pectus also appreciate it. My question is for both Brandon and the doctor, just in terms of any form of regression happening after the bars come out. I know, Dr. Lasasso, I think on the first webinar you said that it's very, very rare and doesn't happen. But I wondered, if cartilage behaves any differently from bone in terms of having a tendency to go back to the deformed structure at all, and maybe if Brandon could speak to his experience, that would be great.
Absolutely. Brandon, you wanna comment on any changes in your chest wall from before and after bar removal?
Yeah, absolutely. So that's a good question, and that was one of my biggest concerns. I think that's everybody's probably biggest concern, because you don't want to go through this whole process for nothing. It's been 6 weeks for me since the bars have been removed, and so far so good. I have not noticed, and believe me, I'm checking it out all the time, because I sleep on my side. It's just the way I do it, and I feel like, and maybe Dr. Lasasso can say something about that, if that's good or bad, from the bars being removed. But I'm checking it all the time, from how it was when the bars were in to now, and so far so good. I haven't noticed any regression. So definitely a big concern though.
Absolutely, it's a big concern. I don't think I've taken a bar out of anyone in the 20 years I've been doing this where that question hasn't been asked of me. And I always respect the concerns that you all as a community have regarding that. You've gone through a lot to get to the point where your chest is corrected, and it's not surprising that you would have some concern about whether or not it will return once the bar or bars are removed. In my personal experience, I have not had anyone recur that I know of my patients after bar removal. I will say that I have seen some patients from other providers where the bar was removed a little early, in my opinion, and there was a little regression because there was additional growth, okay? But if you achieve, as a patient and as a surgeon, an acceptable correction, and you allow the bars to stay in for the 3 years minimum that I've described, and the patient at the point of removal is not growing, then there should be no appreciable change in the contour of the chest once the bar or bars are removed. So I can say with great, certainty that if you've achieved a good result after insertion, you should assume that that good result will maintain itself after the bar or bars are removed. Next question.
Stan S., I'm going to go ahead and ask you to unmute yourself. You're up next.
Hi, Dr. Losasso. Can you hear me?
Yes.
Yeah, great. Yeah, thank you so much for the presentation. It's really amazing to have this information out there. My question is actually along the same lines as Nabil's was. Maybe I'll just add to it. Do you think that rib flare has any effect on or contributes to pectus regression?
That's a great question. I think the short answer, Stan, is no. Because rib flare is just like, the other parts of your chest wall that evolved and matured in a fashion consistent with pectus excavatum. Those lower ribs, the costal margin as it's called, are the ribs that are widest and longest. So by virtue of that, they will be the ones that are most maximally deformed. And when you correct the chest, sometimes those longer, wider, and more deformed ribs will stick out because that's what's necessary in order to get the central portion of the chest pushed forward. In my opinion, that rib flare is a natural part of the correction and should improve along with the rest of your chest while the bars are in place. It's been my personal experience that most rib flare gets better over the course of the bars being in place and during that phase of treatment. And it's seldom that changes appreciably once the bar or bars are removed. I think sometimes rib flare is a problem for some patients in the hands of some surgeons, because some surgeons tend to overcorrect patients, and overcorrection with a bar very low placed in the chest wall will lead to an exaggerated costal margin and more significant rib flare than if one didn't overcorrect that very sensitive lower part of the chest wall. So I think we're starting to talk a little bit here about the art of the operation, how you bend the bars, how you envision reshaping the chest. And that's a conversation that every patient should have with their surgeon. And it would be important for every patient to see the work of that surgeon and see befores and afters and try to get a sense of what is the artistry of the individual that you're going to entrust your chest wall too. And I think the people that do this often should be willing to allow you to see their work in that fashion. And I think it's important for you to understand that there is some variability in how people do the operation that results in, the cosmetic aspect of the outcome. I wouldn't get too fixated though on rib flare. One, because it generally gets better. Don't judge it early in your journey, okay? Wait until the end of the journey to address it. And one can address it at that point, if it's an issue, with external compression. And I think that can sometimes be the answer to fine-tuning that area of the chest wall if the patient is really disturbed by the degree of rib flare they have. But I've never seen rib flare get worse once the bars are removed. And I've never known rib flare to result in the reversal of an otherwise excellent or good chest wall correction. I've never seen that in my patients. Next question.
Lyle, do you have a question for Dr. Lasasso?
Hey guys, I'm not sure if you can hear me. I'm actually the patient who submitted the questions. I'm calling out of Melbourne, Australia. Thank you so much for answering those, Dr. Lasasso, and thank you, Brandon, for your story. It's great to hear a fellow patient go through this. So I won't get too specific. I'll try to keep it as general as possible for others' benefit. But as a bit of background, so I had the procedure performed a couple of years ago. I'm 36 years old now, so an adult patient indeed. And post the procedure, or should I say pre the procedure, I was fairly active, often running and exercising and weightlifting and that sort of thing. Post the procedure, unfortunately, I have not been able to resume any of that activity because of ongoing pain. Sometimes it's severe and sometimes it's pretty mild. I wanted to know, Dr. Lasasso, in your experience, if you've had a similar patient, but post removal of the bars, that patient has been able to reverse the chronic pain or whatever symptoms they're experiencing and continue with their active and physical lifestyle.
Well, Lyle, those are very good questions. They're very specific to you. And to answer your specific questions relative to your case, I would need to know a little bit more about your case. So I'm just going to answer, and I would be more than happy to address your specific questions if you just reach out to me at my office. I know there's a tremendous time discrepancy, but if you call and talk to Allison, I'm sure we could arrange a time when I could speak to your specific situation. I probably need to see some x-rays so that I can get a sense of where the bars are positioned within your chest and see some pictures of your chest to see to what degree you've been able to achieve a correction. But in general, I would say that chronic pain syndromes after the NUS procedure tend to be very, very rare. They tend to be short-lived, as Brandon was talking, weeks to months at most. If you're a couple of years into your journey, which it sounds like you are, then that's not a situation in which I would expect one to be having pain that would prevent you from returning to the active lifestyle that you enjoyed preoperatively. So I think there's something unique about you, Lyle, and I don't exactly know what it is, but I'd be more than happy to evaluate you as best I can at a distance and give you my opinion. But the short answer to your question is that one should expect to get beyond the acute pain phase of insertion within weeks, and you should, any discomfort that you have long term, like Brandon said, he had this feeling of restriction that he had almost come to sort of consider the new normal, and was only really aware of it once the bars were removed. That's a pretty common experience, that it's not, you don't really even know how the bars were affecting you until they're finally removed. And then you take big deep breaths and you realize, man, a little bit of that restriction I was feeling what was the actual bars themselves. And I'm so glad that that's now gone. That is a common comment that I hear from patients a few weeks after bar removal. But serious chronic pain syndromes are not part of a well-executed NUS procedure, in my opinion.
Okay, well, thank you. Thank you. Oh, sorry.
Can I elaborate on my experience with that?
Yeah, Lyle, I just want to say, please take me up on the offer. I'd be more than happy to look at your case specifically. Yeah, go ahead, Brandon.
Okay, so that's a great response, in my opinion, Dr. Lasasso. For me, just because it's kind of a weightlifting and you said you were active prior to the surgery, I will say it was about 3 months post-op is when I just absolutely had to get back in the gym. And when I first started going back, simply laying flat on a bench hurt terribly. It was hard to stretch my body out. I pushed through the pain. I was in a lot of pain at that time because I think I was completely off the pain medicine by that point, I'm sure. 3 months. So, I started out with just a 45-pound bar, and that hurt, and I was in a lot of pain. But I think that, I put myself, a lot of my pain I probably put on myself just because I couldn't not work out. I was going to make it happen one way or another, and I just pushed through a pain. And I think that ultimately forcing myself to stretch ended up helping me in the long run. By 1 year out, and I'm not trying to brag, I think everybody's a lot different and experiences pain differently, but within a year or about a year post-op, I was back to a 300-pound bench press, which was that made me happy. But it took a lot of work to get back there and pushing myself through a lot of the pain. But that's how my experience went.
And I would agree with Brandon. I think the tendency is to generalize from one person's experience to your experience, and I would caution everyone out there listening tonight to take Brandon's experience in context, knowing that Brandon's experience will be different than your own. But I would say, knowing Brandon as I know him, his result was in no small measure due to the fact that he really did get back into the gym. He did push through some of these moments of discomfort to get back to doing the things he loved to do. And I think that is really what I would encourage you all to do that are either going through the process of having the bars in place and are in the process of that 3 years until you get to the finish line. Try to be as active as you can be. And I would agree with Brandon. I think stretching is as important as resistance. And so I would encourage you all to get into a program where you make stretching and range of motion as important as any resistance training that you may do. And don't forget the importance of continuing to build your aerobic capacity as you go through the stages of recovery, because in the end, that is the most important part of your rehabilitation, is to increase your aerobic efficiency and capacity. That's what the bars will allow you to do by removing the compression and displacement that the chest wall has on your heart. And so I would encourage you all to spend time stretching and doing some form of aerobic exercise. It can be as simple and as low impact as a brisk walk, up to and through running or swimming or biking. But don't forget to do these things, and do them long after the 3 months of formal physical therapy and rehabilitation, because in the end, that's what's going to give you the best overall result.
Next question, Nick Mende, do you have a question for Dr. Lasasso?
Hi, Dr. Lasasso. My question is also about regression. If you are to see any regression, would it typically be immediately after the bar removal, or is that something you would see over time?
Well, Nick, I would say it would be something you would see sooner than later if you're not growing. Let's say you're an adult patient, you've had the procedure for some reason wasn't done technically well, and the bars were removed. I would say that it would be something that you would experience sooner than later.
Great,
But
thank you.
But again, I've not, in my patient population, I've not seen it.
Stan, do you have another question for us? Stan S., I'm gonna unmute you. We can't hear you.
Oh, sorry.
There we go. Perfect.
Okay, I forgot to hit the button.
This Zoom thing.
Thanks for taking my question again. For someone who had a lot of fluid buildup a couple of months after bar insertion, should I expect the same after the bar removal?
That's a great question, Stan. Was the fluid under the skin or inside your chest cavity?
Inside the chest cavity, they have to do a lot of draining with the needle.
Yes. Okay. So that's called a pleural effusion, and that's
Right.
something that occurs acutely in some patients. And your expectation should be that kind of fluid inside your chest should not happen. I repeat, should not happen with bar removal.
Okay, great, thank you.
Okay, and the reason for that, Stan, is because the course of the bar inside your chest is completely encapsulated. It's completely separate from where your lungs are and where your heart is. It's in its own separate little box, if you will. And as long as that is well developed, which it should be if you wait 3 years before removing the bar, then your expectation should be, if the surgeon meticulously and atraumatically removes the bar from your body, there should be no accumulation of fluid in your chest cavity. That's why we always get a chest X-ray immediately after the bar is removed and before the patient is transferred from the operating room to the recovery room.
Laura Flores Miranda, I'm going to unmute you or ask you to unmute yourself.
Hi, I'm here.
Lovely.
Hello, doctor. Yes, thank you. Hello, doctor. Thank you for taking my question. I'm calling on behalf of my daughter who had 2 bars installed at the age of 13, and she is now 15. Since
Okay.
then, we've discovered that she has hyperflexibility syndrome.
Okay.
Have you treated pediatric patients with a form of EDS like this or hypermobility? And if so, what percentage of a positive outcome can we expect?
Well, I think you should expect a good outcome. I don't think ED patients are any less prone to a good outcome. Let me ask you this: has your daughter had a good cosmetic result from this, or has she over responded to the force of the bar?
I believe it's been an over response. She has one shoulder that's higher than the other. She is dealing with a lot of chronic pain, and we are a year and a half later. She's also very, very thin, 100 pounds. And so the bars do protrude on one side. So all of that it's very hard to tell. There's still a bit of an indentation. And
So,
may I add,
sure.
Go ahead.
No, go ahead. I'm sorry, I didn't mean to interrupt. Go ahead.
Well, one of the things that was a little bit scary was that when she had the bars installed, 2 days later they slipped. And so she had a reconstruction a few days after her initial surgery. So we weren't quite sure what had happened there. She also had slipping rib syndrome and had surgery for that as well during the right before the pectus surgery on the same day.
Mm-hmm.
So there was kind of a lot of trauma there, but we weren't sure why they slipped so quickly. And we were thinking it's because of the hypermobility.
Well, again, I don't think that those two are necessarily related, but again, I think that it's hard to make any firm comments, any absolute comments, because your daughter is very unique. Every patient is unique. Your daughter has some very unique issues that are part of her overall situation. And so it's very, very hard for me to comment specifically on your daughter. But I would say that I have operated on patients with both Marfan's and hypermobility syndrome. And I've achieved some good outcomes, albeit with some Marfan's patients, they've sort of overreacted a bit to the bar. I've had to remove bars on patients like that a little early because they were over responding to the bar. So there is uniqueness to how patients who are along this connective tissue continuum respond to the NUS procedure. And those specific issues need to be addressed as the patient, progresses through the treatment. And so it sounds to me like, there have been some very unique aspects to your child's journey, and I'd be more than happy to talk with you more about it, offline, specifically with your daughter and looking at your daughter and your daughter's case. Okay, so please feel free to reach out to me should you wish to do so.
Great, thank you.
You're welcome, Laura. Good luck, and good luck to your daughter.
Thank you.
Anybody else have any follow-up questions? Perfect. I think that does it for tonight. Thank you, everybody, for joining us. Dr. Lasasso or Brandon, do you have any final comments?
Brandon, I'll let you go first.
Okay, yeah, so that would be kind of pertaining to feeling like the bar slipped at all from my experience. And again, I think that a lot of my pain was self-inflicted just because I pushed so hard to get back into shape in the gym and stretching my body and everything. For the same time, I think in the end, that was good that I did that. But there was multiple times in the first year, because of, I think probably weightlifting, that I swore up and down that my bars moved. And I think I called you a couple times probably saying just that. And so I went and got x-rays, and I'll say every time that I went to get x-rays for anything, I always asked them if I could take a picture with my phone of the x-ray. That way I had them all on my phone, and I would look at all of them throughout the entire time I had the bars and compare all of them, and they never slipped. They never moved at all. And I put, if they were going to move on anybody with what I did, they probably would have moved. And, I just had a lot of faith in Dr. Lasasso and his ability, and doing over 1,000 of these surgeries. I went into the whole surgery completely calm, and I did not, I wasn't worried about it at all. But even when I thought the bars moved, they never did. So.
Brandon, well, I want to personally thank you, not only for the courage that you showed through a very, very difficult procedure, multiple procedures over many years. You never wavered. You always stayed positive. You were just a great patient to work with. And I'm so glad that you're sharing your insights with the community. You're a real asset to this community, and I hope you and I can continue to do these talks together, because I think it's as important for patients to hear from you as it is to hear from me. So I want to thank you for your time tonight, for your desire to share your experience with your community. It's a great gift you're giving back to people who need to hear the story from people like you. So thank you very, very much. And I will say this, that Brandon's sense of the bars slipping, I will contend, is the chest wall moving slightly in response to the bars. And that's very difficult for patients to discern one from the other. So if you feel something moving in your chest, assume it's your chest and not the bar, but always make sure that your surgeon is aware of that sensation so they can reassess you and make sure that it's not the bar moving. Because the bar moving, though very rare, is something that definitely needs to be identified and addressed. So please make sure, just like Brandon did with me, that you check back in with your provider and let them know that you're having that sensation. But in general, it's not the bar moving, it's your chest moving. And with that, I'd like to thank all of you for your interest and your participation. It means the world to me that there are people interested in being educated and knowing more about this condition, a condition that I've devoted my entire career to addressing. And it's very gratifying to know that I'm helping many more people than I'll ever be able to operate on. And to that end, I will continue to try to be a resource for this community, both through these webinars and through my practice. And I want you all to know how gratifying it has been to me to help all of you over the course of my career. Thank you very much. And with that, I will say, stay well, stay healthy, and I'll see you at the next webinar. Good night.